Hello everyone, welcome back to my channel. Today we're diving into something really important, especially if you work in community services, health or care roles, and that's duty of care. It's a term we hear a lot, but what does it truly mean? And how does it impact us? And how does it impact the safety of those around you? So let's make it simple. Duty of care means having a legal and ethical responsibility to take reasonable care of someone or your clients and protect them from a foreseeable risk. In other words, from things that could realistically go wrong. There's no one size fits all definition for reasonable care, and it would be different for each different scenario depending upon the situation. But the bottom line is, if there's a risk which is obvious or likely, you have a responsibility to do something about it. Let's look at a real world example. Imagine that you're managing a youth refugee, and there's always a chance that conflict could break out between your clients, and that's your foreseeable risk. Now, you can't control everyone's emotions, but what you can do is to make sure that your staff is well trained, your environment is supervised, the support systems are in place, and that's your duty of care in action. Thinking ahead and doing what's practical to reduce the chance of harm or risk. Duty of care applies to three key groups in community services. The first one is staff. So as an organization, it is your obligation to provide them the safe working environment, provide them all the necessary resources and equipment, and make sure that the environment is risk-free or harm-free, and also not just physically harm-free but also emotionally. You're providing them the support that they need. Could be debriefing sessions, could be employee assistance programs. So as an organization, you do owe a duty of care towards your staff. Second, we have clients. To our clients in community services, we owe a duty of care, utmost care towards them. That means that every time that I'm delivering the service to my client, their well-being is my priority, and I must not do anything, or I must not do my work in a manner which may cause some sort of a risk or harm to my clients, and that's my duty of care towards my clients. And third is other people in the community. That could be your neighbors, that could be other general public, and we all owe a duty of care towards other people, ensuring that our colleagues are safe working with us, our neighbors are safe living around us. So in that ways, general public should also have the same accountability and be respectful to each other, owing that duty of care towards each other. This includes your co-workers, visitors, or even the general public. For example, if your agency works with people who inject drugs, so then it's your duty to make sure that the used needles or any sort of equipment is disposed in a proper manner so that other people are not at risk. That's your duty of care towards other people in general. What is a breach of duty of care? So a breach happens when someone is harmed because another person is either negligent, or they acted carelessly, or they didn't do something, they failed to act as they should have done. So in a situation where there's risk, and that's clearly foreseeable risk, you didn't do anything, or you did something which causes some sort of harm to your clients, to your staff members, to other general public. So in simple words, if I say, if someone gets hurt and it could have been avoided by taking some action, a reasonable action, that's likely a breach of duty of care. So how do we know that there is a breach of duty of care? If the court were to investigate that whether a breach has happened or not, they would go through some sort of questions, and they would find that there's a reasonable person in the same role who has done something or hasn't done something that caused harm. So they may look at various factors such as the skills and qualification, the trainings of this person, the relationship of this person with your clients. There could be other factors such as the age, whether your workplace had the right policy and procedure, or whether you had the access to the right policy and procedures, and what resources were available when you were in that role, what staff and equipment were given to you when you were doing that. It's not about being perfect, it's about doing what's reasonable and practical in your position. Duty of care isn't just a legal requirement, it's a mindset. It's about staying aware, being proactive, and making sure that people around you, whether they are your clients, staff members, or the members of the public, they are safe and they're respected. And it means that stepping up when something doesn't feel right and asking questions and taking actions, and it means putting others first, putting your clients first, putting their safety and well-being first. In community services, you're not just supporting people, you're also protecting them, and every small step you take towards the safety and care makes a real difference. So if you are working in community services or you want to work, remember that duty of care is not an extra work, it is the work. Thank you so much for watching. If you enjoy this video, please give it a thumbs up. Please also share my video with other people. I'll see you in the next one. Thank you.